So we stopped on the Digoxin. True? So far last week, I killed Lovenox, I killed heparin, I killed Coumadin, I killed the Digoxin. So now we are on BP meds. So look, I want you to know your beta blockers, calcium channel blockers, ACE inhibitors, other BP med, your anti-angina med, your anti-lipids. All right? Okay? Any question? Okay? And let me put one thing here. Potassium sparing. Right? Potassium sparing. Okay, so let's go. Right? Now, you remember I gave you a drug list. Can I see your Shannon left? Oh, yeah, she had to leave. You see the top 200 drug list? Let me show you something. The top 200. Everybody have it in the packet. Let me show you. Many. Right? So, let me, yours is out. Listen, this is 200 drugs. Suppose time is of essence. And you say, oh, Miss Sonia, I cannot do all the drugs you do. Do you have a cheat sheet? They go to top 200 drugs. You do this whole little page, front and back, you still should be okay. Did y'all hear that? I do each system, I do the drugs with it. But suppose if I get time, you can do that little sheet. Don't say you don't have one. All right, get your $5 out if you don't, because you know Miss Carrie gonna pull out the contract. You signed for it. It's a top 200 drugs. It's a little cheat sheet, but don't use it alone. Right? So let's go. Page 7. So we are left on page 710. We talked about the Lasix, right? We on 710, and I'm going to pick up from here. We're going to talk about Asthmatic Diuretic. And what I want you to know is mannitol. Mannitol is given for acute and closed glaucoma. Mannitol is, I'm on page 710, box 51-9. You see it? They call it asthmatic diuretic. Not only you give mannitol for glaucoma, you also give mannitol for ICP. While you're giving mannitol, it also lowers BP. Right? So no mannitol. Box 5110, there's a drug called Dimox. Dimox is called a carbonic. When not NCLEX, they don't say Dimox. They will put carbonic, eufinavol. So you need to know mannitol is asthmatic, and you need to know Dimox is a carbonic. Dimox, is used for open-angle chronic glaucoma. So let me explain to you. There's two types of glaucoma. If you're diabetic, you have what they call open chronic. So we give you pilocarpine, Zelantin, and we will give you Dimox. So I say open chronic glaucoma. Now, when you have closed acute acute, that means glaucoma with pain, we give you Diamox. Not Diamox, pardon, mannitol, excuse me. So mannitol is for glaucoma that is closed. That means you woke up, you won't do leg. That is closed, acute glaucoma. Open angle chronic, P not so glad. You will give Diamox. Any question? So mannitol and Diamox are given for glaucoma. Diamox for the glaucoma that not so bad. Mannitol for the glaucoma that is bad. Any question? And glaucoma is pressure in the eye. Any question? Then we going into the potassium sparing. This one. So here you're going to do just like this. If you did this chart, all you're going to do is box 5111. You put 5111. You can put the page number for you. All you need to know is one drug. Well, two. It's called, ready? Spironolactone, adactylone. You see it? Spironolactone, adactylone. Adactylone, spironolactone, is a diuretic, but instead of making your potassium low, your potassium is high. So when the patient is on adactylone, which food you want to avoid? High what? Yes. Any question? Now, when you are on spironolactone, the patient going outside, you need to tell them to wear a hat, it be long sleeve, because it's photosensitivity sunlight. Any question? Anytime you giving spironolactone, you need to do EKG. You're going to find P, short, T, tall, no, you wave. Sana tesimunyo. EKG. Any question? How do you know the potassium is way high? Diarrhea. Anytime the patients have GI problem, diarrhea, when my potassium is low, I'm constipated. When my potassium is high, I'm diarrhea. Any question? Okay. Only one drug and one more. They do ask. Trimetrin. Yeah. They ask you that. Trimetrin, which is diarrhea, is on the people test. Trimetrin and spironolactone, Desayo, 2 drugs. Don't go no more. Box 5111. Box 5111. Trimetrin is the bottom one, and adactylone. We cool? Now, box 5112. I call these other drugs, other BP drugs. Miss Sonia, what do you mean other BP drugs? Let me tell you what does that mean. These drugs are given for something, but they lower your BP. Ready? Flomax. Highlight it. Flomax is given for what? Prostate, BPH. Uricsterol, urine. Cardura, heart. Regitin, where did I teach you Regitin? Psych what? See, this is, see, wait a minute. See, you see, this is how I know the student ready. right when you see a drug and you see a disease, right away, you're supposed to bring me with you. So I ask you Regitin. That's it. Right? Side what? Anxiety. See, right there. Anytime you see a student come to me, ask me, what you think? You think I'm ready? I give you one thing. You don't know where it is. That means you don't. That means you memorize it. Right? Huh? Yes, ma'am. Psych. Antidepressant. MAOI. When you eat food with tyrosine, you get a high blood pressure. That's it. No, you didn't say. Mommy say. You didn't say. She said. You told me psych. Psych what? Psych Bernard, Psych Macy, Psych Swap Shop, Psych what? Okay, just mommy said. She said psych, antidepressant, MAOI. Now we talk. NCLEX said it. What am I saying? If you can't do that, I guarantee you shall fail. That means you don't know the disease. You got it? All right, I'm watching. Let's go. Now, so others, Minipress, Flomax, old student, a student that did a neuro with me, raise your hand. All right, if you did neuro with me. Now, which disease that Miss Sonia mentioned this Hitrin drug? What is it? Come on. She did it with you last night. Spinal cord injury. When you hurt your back from T6 on up, you get a high blood pressure. We put a Foley. Which drug would give you? Nitroprusin or hydrazine? Remember that? What is it? Where is it? It's in meds. Hydrazine is Hitrin. Hitrin. Remember we talked about hydrazine, we talked about Hitrin, we talked about nitroprusin. Remember when I did med surge, spinal cord injury from T6 on up, you have a complication called autonomic dysreflexia. What's priority? You put a Foley. You remember that, Diana? Now it comes. All right? So these drugs are given for other things, but they lower BP. Here's the famous one, Clonidine. Where did I teach you? Come on. You go on the NCLEX. Clonidine, psych anxiety. Give it to me better. Antidepressant. Psych. Alcohol withdrawal. Hypertension that happen in alcohol withdrawal. When you give Clonidine, the patient commits suicide. We don't know if they commit suicide because of the alcohol or the what? Clonidine. Because anytime the patient takes Clonidine, the patient hallucinates, the patient depressed, and the patient may commit suicide. I said Clonidine come in a very small pill. We got 0.01 and we have 0.02. I told you Clonidine is given with, it's like an as needed. You give it to Roxy, yes. Clonidine will never be the only BP drug of choice. I will give a beta blocker, and if the BP don't come down, you're going to give a little Clonidine with it. The only time you see Clonidine given by itself, alcohol withdrawal. Any question? That's what I said in class. You true? So we did it in psych. Now we're doing it in what? Cardio. Any question? So these are called other BP meds. Miss Sonia, what does that mean? You give it for something else, but it causes BP to go down. That is why when a patient has prostate problem, obey flow max, you must check their BP and the heart rate, because one of the signs and symptoms of flow max lower what? BP. Any question? And flow max comes 0.4 milligram. We cool? All right. Not so good? No, really. Now, my first BP med I'm going to talk about is Mr. ACE inhibitor. ACE inhibitor is a blood pressure medication. It is the strongest BP med you can give PO. ACE inhibitor is the strongest BP med you can give PO. ACE inhibitor work on the kidney. There's two types of ACE inhibitor. Two types. One that ends with pril and one that ends with sartan. Oh, not statin. Statin c'est graisse. Sartan. There's two types of ACE inhibitor, because ACE inhibitor work on the kidney. How, Miss Sonia? All blood pressure medication don't work on the same part of the body. Résultat is to lower your BP. So, for example, beta blocker work on the heart. Calcium channel blocker work with the calcium that works on the heart. ACE inhibitor works on the kidney to lower the BP. So, résultat c'est même, but it works on different part of the body. So, let's go. Your ACE inhibitor, Miss Sonia told you, it's the strongest PO. I didn't say it is the strongest blood pressure medication out there. I never said that. I said it is the strongest PO blood pressure medication you can give someone. Now, not only this is strong, it's kind of problematic. It's problematic for people who have diabetes. So if she has diabetes and high blood pressure, you will not give her ACE inhibitor. She'll sleep all day, all night. ACE inhibitor causes sugar drop. Beta blocker, calcium channel blocker, all of the other ones make your sugar high. So if your sugar high, you're going to say, ma'am, check your sugar more frequently. If it make your sugar low, you just don't give it. So ACE inhibitor, you don't give it to a who? Diabetic patient. We got that. Now, you remember last week I gave you heart failure? You remember I did that so pretty. And I said you give the Johnson for the heart. And you give the Lasix to remove the water. Remember that? For heart failure. Now, when the Johnson and Lasix don't work for heart failure, you give ACE inhibitor. You never give a heart failure patient ACE inhibitor, the Johnson and Lasix. If the Johnson and Lasix don't work for them, we'll buy you ACE inhibitor. She got heart failure left. I'm going to give her the Johnson Lasix beta blocker or the Johnson Lasix calcium channel blocker. But you never give a heart failure patient ACE inhibitor, the Johnson and Lasix. You're going to give ACE inhibitor or. So ACE inhibitor fait même job avec the Johnson Lasix ensemble. English, ACE inhibitor is so strong that it does the job of the Johnson and Lasix combined. Any question? When you, yes, question? Yes.
So you're saying if the Lasix and the Johnson do not work, you give the ACE inhibitor. But
for heart failure.
For heart failure, but you cannot give 3 of them at the.
Yes, you can give the Johnson Lasix beta blocker for a heart failure patient. You can give the digoxin, Lasix, and the calcium channel, but you will not give the digoxin, Lasix, and the ACE inhibitor, because ACE inhibitor does the same job of the digoxin and Lasix. It's so strong. You got it? Yes.
Can we start, instead of these two together, can we start with it first?
No, they will never start with, because ACE inhibitor affect for high blood pressure. Anytime the patient on heart failure, my bowel médicament pour heart failure, c'est digoxin and Lasix. C'est si ça back right. They will never start on ACE inhibitor. Excellent question. Never. Because that's not what it's for. It's like, look, Mom, you got diarrhea, and I give you morphine. Is that what it's for? The side
effect of morphine.
Okay. Now, so we have Prill. Miss Sonia, what is the Prill work? What part of the kidney? Angiotensin 1, and this work on angiotensin 2. So anytime you give ACE inhibitor, you must check BUN creatinine, parce que the drug work on the kidney. So listen, watch. Where did I teach you lithium? Side menu. Lithium work as a what? Salt. So the patient is what? Dehydrated. You remember that? So imagine if you want lithium and I give you ACE inhibitor. That's going to make the patient what? Dehydrated, because both drugs work on what? NCLEX question. Who did not catch that? Anytime the patient on lithium, ou pas bay ACE inhibitor travaille sous kidney, lithium travaille sous kidney. So, low by li ensemble, the patient will be so what? Dehydrated. Guys, you see, when you understand, it feels so good. True? Now, the ACE inhibitor are your Prill, right? The Prill causes a cough. The 10 cause a cough. Both. ACE inhibitor make your sugar low. ACE inhibitor leave a bad taste, like a metal taste. So when you take ACE inhibitor, you gotta give them sweet stuff. Very important. NCLEX question. ACE inhibitor. ACE inhibitor, right? I'm on page 712. 712. Okay? ACE inhibitor cause bleeding. So remember, which drug would you question? Clonidine. Okay? ACE inhibitor cause a cough. Hey, why are you going to call the doctor? Not because he don't know, because the patient cannot sleep. So the ACE inhibitor bother at night. That's why you're going to call the doctor. Not because the doctor don't know. So the students say, oh, Miss Sonia, it's expected. I don't need to call the doctor. Yes, you do. Patient cannot sleep. ACE inhibitor is anytime you see your doctor put you, the first blood pressure medication he put you on is ACE inhibitor, that means you came in late in your BP situation. That means you had that BP for a while. In order for him to give you ACE inhibitor, you had to come to him 3 times. He found 160 over 85. Anytime the bottom is so high, you're in trouble. That means the left ventricle is working too hard. See, the top is not the problem, it's your blood pressure. We could work on the top, it's the bottom. It's the problem. It's the bottom that stroke you out. So the student say, oh, the patient 180 over 68. The nurse go crazy. There ain't nothing wrong with that patient. He's stressing about something. It's the bottom. The 180, soon as he rests, Go wash his face, calm down. You see the 180 go down. But bottom now. They be not 85 more dead fish. You gotta really watch him. That means the bottom is just working. Go, 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 go. And the patient can turn out. We go? Yes.
Did you say that after the middle case, you see it could what? You did not say that they were bleeding.
Yes. I told you ACE inhibitor cause bleeding, bruising.
Thank you.
It's right in the book. Right here. All right, page 712. Bruising, petechiae, bleeding. Okay? Any question? Make sure you know that. You know why when the patient is on ACE inhibitor, they vomit and they have diarrhea? It's because the potassium is so high. ACE inhibitor make your potassium high. You guys gotta recognize that. When your potassium is low, you constipated. All right? Any question with ACE inhibitor? And they go to Kendisartan, Atican, Eprosartan, Ibersartan. You need to hold up, you need to know all the page. You need to know all 5114. They can give you brand generic. And when you studying drugs, you need to know brand and generic. Okay? Any question? Now you're going to go into, since I'm here, anti-angina medication. All you need to know is nitroglycerin. Nitro, it's anti-angina. You're going to say vasodilator. Vasodilator, right? Nitroglycerin open, right? It opens what? It opens, dilate what? The arteries. So blood can flow. See, students say, well, nitroglycerin is a blood pressure med. No. Nitroglycerin, open it, blood flow. That is why blood pressure go down. Nitroglycerin, some BP med. No, your BP med are your beta blockers, your calcium channel blockers, right? Your ACE inhibitors, your hydrochloride. Those are BP med. Nitroglycerin is a vasodilator that causes BP to go down. Now, nitroglycerin come in PO. It comes in a patch. It comes in a cream. And it comes in a spray and some more stuff. Now, nitroglycerin has to be renewed every 6 months. Nitroglycerin is a life and death medication. The PO comes in a little brown bottle with a cotton inside. No light. You don't want light to expose it. And you don't want that bottle to be outdated. Nitroglycerin, you give it for angina. There are 2 types of angina. Stable, unstable. Now, nitroglycerin, stable angina that you give it for is expected. Meaning, I went to mow the lawn, I have chest pain, ubali. Unstable is I'm sitting down and I have chest pain. So that is worse. Stable, unstable, MI. Stable, unstable, MI. Stable, you give me 1 nitroglycerin under the tongue. Do not chew, right? Wear gloves because nitroglycerin causes a headache. Like even nurse, if you touch it with your hand, hell, even when you come in the room, it's like a little paste. Soon as you open it, you feel dizzy as the nurse. It's a very potent drug. Now, nitroglycerin, RN, if you're giving it IV, you must use a special tubing for the IV, and you must cover the bag with a brown bag so it will not get exposed by the light. You give one, you check the BP, you check the heart rate. You give 3, you wait 5-minute increments. Give, check BP, check heart rate, right? Wait 5 minutes, give another one. The same thing. Check BP, heart rate, then you give another one. Any question? If after 3, it doesn't go away, the patient in MI. Now, nitroglycerin, when you're giving it, if you're giving it the little sticky on the patient body, you need to assess. Make sure Nurse Sonia didn't have one here, Kyle had one there, the patient BP gonna go down. All right? At night, nitroglycerin, you want to remove it. Why? So the patient will become what? Tolerance. Okay? It is normal that a patient is on nitroglycerin and they get a headache. It is normal when it's under the tongue, it fizzles. Like Pepsi or 7-Up. You see how that funny tastes? That tells you it's fresh. If it don't fizzle, like a tingling, that means it's outdated. You gotta watch that. LPN, who are licensed practical nurse, anytime the doctor call you for an order for nitroglycerin, Clonidine, you better initiate it. Once I commence, you may not finish it, but at least commence, because those are life and death drugs. Any question? Make sure you know nitroglycerin. Nitro quick. Sometimes they say nitro this, nitro that. Right on NCLEX, if they say nitro quick, you already know it's what? Nitro. Or they say nitro isobabide. I'm in box 5115. You need to know the whole box, but it's understood. If I say isobabide, you know it's nitroglycerin. Okay? Any question? Okay. Then we're going to go to beta blockers, which is box 5116, box page 714, 5116, beta blockers. Beta blockers end with lol, metoprolol, atenolol, tutlol, right? Tutlolio. Beta blockers work on the heart. So anytime you give beta blockers, you must check BP, heart rate. NCLEX know you know that. Well, matter of fact, anytime you give any BP med, what check your heart rate, BP. True? Now, anytime you own beta blocker causes some problem. One, it causes you to have respiratory problems. So if she already has COPD and high blood pressure, and I go give her beta blocker, what happened to her COPD situation? Worse. That's why anytime a patient has respiratory problem, you don't give them what? Beta blocker. Anytime a patient is on beta blocker, you must do ABGs. You got it? But you on NCLEX, you'll say check BP, check heart rate. You do that for all blood pressure men. Now, beta blockers cause you to hallucinate. So think about it. I'm 70. It's 6 o'clock. You go give me beta blocker. I'm going to tear this room upside down. You don't know if I'm tearing the room up because I'm old, sundowners, or the beta blocker. Beta blocker causes you to hallucinate, depress, and beta blockers cause your WBC go down. Anytime the patient is on beta blockers, you know you have to check their WBC. It makes them at risk for infection. But the school taught you, anytime you give a beta blocker, check BP, check heart rate, that. What about respiratory? right? What about infection? What about loop, 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 loop? The patient on beta blocker, lock the door. You know the students never take lock the door. Because you said beta blocker, what that got to do with, you say BP med, what that got to do with locking the door? I didn't, beta blocker caused the patient to loop loop. You put the patient here, you find him all the way on John Road. And watch patient at night, LPN. Give them blood pressure medication. You don't supposed to give blood pressure medication at night. You guys know that. Let me tell you why. The reason you don't give BP meds at night, because BP meds lower your heart rate. So you don't know if the patient is sleeping or if the patient is dead. You see that? That's why you're not supposed to give BP meds at night. Y'all know that. And listen, your BP at night, sundown, you should be calm. Why are you giving me BP med at night? That means something is worse. Something else is going on. Guys, at night, that's when my mind is free. Everything is free. Very less stress. Why is my blood pressure high? Something is going on worse than the blood pressure. Any question? Right? Okay. Then we go to calcium channel blockers. Here's the top 200 drug. Amlodipine, Norvasc. Dialazam. Solar. Verapamil. Epinephrine. Now, all calcium channel blockers, you do not give me grapefruit juice. All calcium channel blockers, especially the Cartia, the Cardira. Yes, you can, Cardiism, Cartia, excuse me, Cartia. Cartia is also given for dysrhythmias. Amiodarone, you remember that drug you give for dysrhythmias? It is a calcium channel blocker. Now, when you give the patient calcium channel blocker, yes, it lowers your BP. Yes, it lowers your heart rate, but something else it do. It for walking bull, swell. Anytime you give the patient calcium channel blocker, you gotta weigh them and you gotta check their legs, their face. If the patient say, I can't wear my wedding ring, heart failure. Yeah. So calcium, so listen, ACE inhibitor got their problem. Calcium channel blocker got their problem. Beta blocker got their problem. Potassium sparing got their problem. Everybody's goal is to lower BP, but different ways of the body. Beta blocker work on the cardio to lower the BP. Calcium channel blocker work on the calcium that the heart is secreting to work on the BP. ACE inhibitor works on the kidney to work on the BP. That's the pattern in NCLEX Act. So they ask you, the patient is on ACE inhibitor, which lab you going to check? UN and creatinine. Is he nowhere on? We cool? Now, then we go into our anti-lipids, progress. So gardez Creole enfant, gardez, and I'm going to say it in English. Gardez. Last week, on nous font a recap. I'm going to hit it in Creole, then I'm going to in anglais. English people, hold on. Last week, je commence avec nous. Je commence avec boule sang. Qui ont fun boule sang. Comme fini boule sang, right? Je parlais de Pouquet, de Jackson and Lasix. Comme fini, je parlais médicaments pour keep sang, qui ça? Flow. Je parlais sur antiplatelet, right? When I finished, I talked about diuretic, Lasix. You see how I'm going to do the disease with you? Oh, I brought English. Sorry. Now, then, comme fini, matin, m'parle pour qui ça? Tension, blood pressure. M'dou in blood pressure, get potassium sparing, get beta blocker, get calcium channel blocker, get ACE inhibitor, other BP meds, anti-angina, qu'on yambe parler de boulettes. You see how organized. So when I do the disease, I'm going to do the disease just organized, just like this. English. When I met you last week, I talked about anticoagulant, right? I talked about antiplatelet. I talked about for heart failure, the Digoxin and Lasix, right? I talked about thrombolytic to burst the clot, right? Now, we're talking about BP meds, and these are type of BP meds. Potassium sparing, beta blockers, calcium channel blockers, ACE inhibitors, other drugs, nitroglycerin, right? And then the last one, grease, lipids. Lipids, we call them statins, not sartan, statins. Statin, c'est une graisse. Lipids, grease, cholesterol. Any question? Now, when you have cholesterol problem, we give you different classes of drugs. Okay? The first class of lipid drug, we call them bowel sequencers. Box 50-119. Bowel sequencers, and the top 200 drug in that box is two of them, Welchol and cholestyramine. Highlight that. Cholestyramine comes like Metamucil. It look like the way, you know how Metamucil is, you gotta mix it. This here, you gotta mix it. You mix it with either water or juice. So if she got problem with swallowing, can I give her that drug? No. Anytime you giving cholesterol, you only cholesterol come look like a gritty powder. Welchol come in pills. Cholesterol, you got to assess the patient's ability to swallow. Now, anytime you are on cholesterol, one of the side effects of the drug is bleeding. But what bleeding? GI bleeding. So when the patient on cholesterol and the patient say, hey, my stool, when I poop, I see blood, stop it, because the patient have peptic what? Ulcer. Addict, whoa, bon Dieu. Miss Sonia didn't say all anti-lipid cause peptic ulcer. That's not what I said. Only what? Cholesterol. The cholesterol. That one. That first one. Question. All right? Any question? The second class of anti-lipids, we call it HMG-CoAs. The HMG-CoAs end with OR, Mevacor, Zocor, Lipitor, pump, the OR. The Lipitor, the Zocor, the Mevacor, the ORs, these drugs, you only supposed to take them for 3 months. Why? They destroy your liver. They destroy your eyes. So that drug, the Mevacor, Lipitor, Zocor, pump, you must check my eyes. You must do liver. And they give you a cramp at night. Won't cramp keep warm, baby. Patient relay. Right? So they give them a cramp. Right? Now, if I cannot walk or I'm not moving, you should not keep me on HMG-CoAs. because it destroyed my liver. Now, out of all the HMG-CoAs, Mevacor caused bleeding. Mevacor caused bleeding. So if I'm on anticoagulant and I got grease problem, you can give me Lipitor, but you're not going to give me Mevacor. Only Mevacor cause bleeding. But I never said all HMG-CoAs cause bleeding. I said only Mevacor. Turn. Other anti-lipid drugs. Zetia, Tricor, Niacin. I want you to put NCLEX next to Niacin. You see it? Anytime you are on Niacin is a vitamin you can buy from Walgreens. Anytime you are on Niacin, you need to take it with aspirin. It make it absorb better. Niacin, aspirin. Depuis passer en plan. Hey, ou ka ina sou vitamine liye. Ou ka ina Walgreens pa achete Niacin nan depuis gen problem apke. Now, what other things NCLEX asks you for heart? Omega-3. Mais écrit. Fish oil. Yes, those things are good for heart. Make sure you know that. Hey, biotin, isn't it for eyes? For hair? Yeah, but for hair, eyes, chicken biotin. They just gave it to my student last week, Florida. And I think somewhere, look, Google and see skin line done too. Yeah, because that was her NCLEX question. That Florida crazy. But my students were ready for them too. That Florida acts up biotin. Hell, the school ain't never touched our biotin, huh? That was on her NCLEX question. So, hey, si Florida by biotin, si on global wrong. That Florida ain't nothing to play with. You better go correct for Florida. Biotin. Yes, Google it, and yes, skin, hair, nails. That was her NCLEX question. And it was for skin. And listen, remember last week I did Accutane with y'all? What did I tell you the other English for Accutane? Vitamin A. That was her NCLEX question. She said, oh, Miss Sonia, I got that. She said the test was very easy. When you get TTA, easy. Right? Okay. Now you're going to go to, so you see Zetia, Tricor, Lopin, Niacin. Guys, you see Tricor because it ends with a core. Don't go say it's a HMG-CoA. Tricor is not. It's other lipids. Your Lipitor, your Zocor, your Mevacor, those are HMG-CoAs. Your classes. Now, you see the one that is called Gemfibrozil. And I want you to put NCLEX. Right, LPN, top 200 drug. You give it all day, all night. When a patient is on Gemfibrozil or Lopin, right? Stay with me. If you give Lopin with your Lipitor, it causes something called malaise, body stiff, muscle ache, like you got the flu. That's an NCLEX question. You don't mix Lopin with Zocor. And that is why sometimes when the patient is taking cholesterol drug, the doctor order Lyrica. Usa. Udule. Don't mix. It's right there. It's number. Pardon me. Lopin. Oh no, you're on the wrong page. No, right here, mommy. Right here. Do not. Any question? Yes. Yes, go ahead.
About the bad acid sequence
Yes.
Question.
Yes.
How to administer
You-
just water before the medication?
Yes, it says comes in a gritty powder that be mixed thoroughly in juice or water before. Parce que son poudre lié, son poudre kon, madame you so. So, Lord, very patient for those mix li.
Do you give water and wait 30 minutes before you give it and after you give water again?
Yes, and I'm going to tell you why. The reason you mix it, if you make blow before and after, because the drug is known to cause constipation. It causes, not only it causes bleeding, but it also causes GI problem. This is what you do. You mix it, you give a little water, after you give the water to help it absorb. That's get some tea granny. It's like a little labouille, it's granule, like Madam you say. Thick. Huh?
30 minutes before giving the medication.
Huh?
You must wait 30 minutes to 1 hour before giving the medication?
What? Giving the medication from what?
No, you give the water. That was the question. You give the water.
You give the patient the water, right?
30 to 1 hour before giving the medication?
Yes, because the purpose of water is for absorption of the medication. You give water before and after. That's an NCLEX question. Okay, yes. Shh. The Lopid, you don't mix it with HMGCOAs, your Lipitor, your Zocor. If you mix it with that, it causes body stiffness, body ache, muscle pain. And that's why the doctors sometimes, when the doctor giving Lopid, they will automatically give you Lyrica. Yes.
You said that Lipitor must give it the quickness, right?
Lipitor has a set time to give it. When I give you Lipitor, or the HMGCOA, I must give it to you not only medication only. I must give it to you with diet, exercise, a plan for you to lose weight, lower your cholesterol. Because if I leave you on it for a year, your liver will collapse. That's the goal. Yeah, but he also make on a diet too. He do fellow bagay because his goal is for it to go because it's going to remove your liver. So anytime you give it, you gotta check for jaundice. Yes, over here.
For the same question about the lipido, because I know nursing home, this patient keep taking this medication all the time. Right?
Yeah, and you continue to give it. You gotta question it. You gonna say, remember, you don't get in trouble for asking, shh. Dr. Mark, Miss Lee been on this lipid drug for so long, since I've been here a year. When the last time they checked the liver enzymes? See, the purpose of not keeping the patient on it, because it destroys the liver. So you remember, you're the patient advocate, and the patient not moving. Right? They're bedridden. Any question? Mañana. So here it is tomorrow. You're going to come in. We're going to start on cardio.